We often hear about Bulgaria being a leading example of deinstitutionalization in Europe. But has Bulgaria really closed all of its institutions? We have come here to visit 3 small group homes and 2 daycare centers where disabled people still live segregated from their community with little control over their lives. Speaking with independent living experts and human rights lawyers, we have understood that institutionalization and coercive measures are still being used. Let's learn more about this. Bulgaria is known at the European level for its institutionalization plan. Would you think it's been successful?
Me as a person, I will say that is better model. As organization, as person who is involved in the process, I can say the same. This is not a good example or model of deinstitutionalization, because we change only the name of institutions from big institution to small group homes.
Do you think there's any difference in practice between institutions and small group homes?
No. We have the same practice here, with social worker in the place, with no support of individual plans of the every person in the small group home to take a next step to go out from institution.
We see that there are in the law some things that we would consider very positive according to international standards, such as the use of individual plans. Do you see that this translates correctly into reality?
Yeah. According to the legislation, the social care and social services should be created and should work around the person, around his or her individual preferences and wishes, but it is not true. It's very formal. Even there is individual plans. They are on the paper and they are formal. And if you check several individual plans, you will see that they are very similar and they are just formal execution of the law. Just this illusion of independency. We visit several places, including places where people from big institutions I know very well had been transferred, and I can see that there is a huge improvement in the conditions. There are new buildings, new machines like washing machines. Rooms are better, but that's it.
The government spent money only for buildings, new buildings with new beds or kitchen or etc. But nothing changed as a policy. They have a staff there which is not prepared, not educated about what is the independent living means.
In each institution they have a daily regime, and when I say institution, this means a small group home. It can be also daycare center, rehabilitation center. Everywhere they have a regime which is obligatory for the people. In the group homes they have obligation to wake up in one and same time, to eat together, to go in the bed in one and same time, to follow the regime offered from the staff, and that's it. People had been moved from big institution from a smaller, and that's it. The model didn't change. We still have a medical model which is not good for the people.
Can you tell us about the cases you're managing now on the people that have died in psychiatric hospitals?
It's related to not only to the death of people who died in psychiatric institutions, but the use of coercive measures, including restraint and seclusion, as forms of torture against them that the state doesn't recognize as
unhuman treatment or torture, and they do not investigate. Those are at least 3 cases that we know from media. The last one was from 2024. A man died in a psychiatric ward in a hospital while he was secluded. He died in a fire. A fire occurred in this isolation room, and the other case was from 2023 where a man was also secluded and restrained. And the other case that we know is from the same year. It's unclear what exactly happened, where was this person, and there is no public information on what stage are those 2 of the investigations. For one of the cases that happened in 2023, we know that there is indictment against a nurse. But anyway, those investigations are related to the death of the persons, and what we were trying to achieve was investigation on the coercion and the restraining of the persons. But this it's not happening, and in the ombudsperson reports there is a lot of information for persons that are repeatedly subject of coercive measures, but we are not aware of any investigations.
Is it common to use restrictive or coercive measures in psychiatric hospitals?
Yes, it is common, and they are not seen as some harmful practices. They're seen as therapeutic practices. There are no clear rules for that, and the psychiatric hospitals are not requested to do some reports or debriefing these situations. It's enough just to say or write down that the person is aggressive, and then they can be restrained or secluded.
How does it affect a person psychologically to be restrained or isolated?
Well, there are a lot of information, including from the World Health Organization, that those measures are inhuman and they should be abolished or avoided. In Bulgaria, they don't see those practices as harmful, not to mention illegal. Chemical restraint is something that no one talks about.
Can you explain what is chemical restraint?
Those are cases where they use medication over patients to control their behavior. And in Bulgaria, they do not use any techniques for de-escalation, and they never observe the reasons. Even if someone is not behaving in the way they expect, they do not investigate or check what was causing that, because people in psychiatric hospitals are subject to many other forms of coercion that are not recognized like any kind of coercion, like restrictions over their regimes, any daily activities. The regime is very restrictive, and in general, when you are restricting someone when to get up, where to eat, what drinks to have, this is a form of coercion that it could constitute domestic violence or other form of illegal coercion, but it's not recognized as such when the person is in psychiatric hospital or in a institution.
Can it aggravate existing trauma?
For sure. I think it's research. This is something that it's research, that it's not a secret in general that coercion and seclusion are harmful practices, and there are countries that try to avoid those measures exactly because of that. They are harmful. They are violating different rights of the persons. In Bulgaria, it's not like that. They are seen as good practices.
Why do you think they're doing this instead of promoting community-based services?
they don't provide community service based services. They
Why?
only they give support only in the institutions, and this person with disability knows very well, and everyone person with disability knows that if they don't have a family, the alternatives is institutions.
So people accept this situation and they become used to it.
I think yes, but I hope this will be changed next year, because the younger disabled people, they look and they see what is the independent living, and they grow up with the different minds about his life, and this will be change that we need from maybe 30 years.
But how do you say for somebody that has maybe grown up in an institution, and this is still true, many children still grow up in institutions.
Yes, but a lot of disabled people grow in the families, and this is my hope that these people will be the wind of the change.
What do you think the government needs to put in place for this to happen? Not only the
government will did not change nothing. They knows that this small group homes in the community-based services is a good one. This is not.
What do they think is good?
They think this is good.
Why? What do they? What?
Why?
Do
this is easiest way to keep people's not hungry, and to have a roof on about that their head.
What do you think the European Union could do? What do you think they could help?
They need to stop funding this policy in Bulgaria and ask our government what you do in another way to support people with disability outside of institutions.
Do you think that Bulgaria is implementing the Convention on the Rights of Persons with Disabilities?
They only ratified convention. They don't put any energy of to make accessibility, to make a convention be the part of Bulgarian law system.
How do you think people view disability in Bulgaria? Do you think like they pity disabled people, that they see them as sick, or as
The government say that all disabled people are sick, and this is not only government opinion. This is community opinion. I'm not sick. I'm in a wheelchair 35 years. I broke my neck, but I am sick when I have influence. There is a paradox, because Bulgarian health system is most inaccessible place in the country.
so you cannot access health?
Yeah, no.
Do you feel as a disabled person, you feel fear that institutions could be the only possibility?
Yes. Now I have a family. My parents are still alive, but they are 79 years old, and after 5 years, how I will live with them or without them? I need to try personal assistant, but with low cost of the per hour. I need to pay for my packet for good personal assistant, and if I don't work to possible to pay this money for my packet, I don't have a choice. I need to go to the institution.
For you, what would true independent living mean?
It's a choice. I can choose to live independently, or I can choose. But if I want to live independently, I can live with personal assistants, one more or 1, 2, 3, 4, how many I need, and to work where I want, to live where I want. Not they say me you need to live here or there, and I have a family. This independently.
Having choice is also having options. Do you think there are
Now I
options?
have no options.
But do you think in general disabled people have options in Bulgaria to live independently?
No.
It's only institutions.
Yeah.
And
There is a small percent of the people who are live independently, but with very limited.
do you have something you would like to say to our viewers from England?
Keep fight. To person with disability, keep fight for independent living, and to government, listen us.
We have seen that Bulgaria has spent millions of euros into building small group homes for disabled people, daycare centers and other segregated settings. These places are dangerous and harmful for disabled people as they lack choice and control over their lives. Bulgaria is not an isolated example, but there is a trend in all of Europe to build small group homes to replace large institutions. In these places, independent living cannot be ensured. Therefore, we call on the European Commission to stop promoting Bulgaria as an example of deinstitutionalisation, to act strongly when funds are being misused, and to put in place safeguards in the regulations so these investments can be prevented. If you want to learn more, read our report.